Chapter 7, Part 2. We led off in the slide in Chapter 7, Part 1. Blood transfusions can be life-saving. Cross-match testing between donor and patient recipients detects compatibilities and cross-reactions. If patient or donor is misidentified, serious complications may result. Around transfusion hemolysis, agglutination, which is the clumping of red blood cells, organ damage, and death. Figure 7/9 I will go over in great detail in class. This is the 5 different white blood cells or leukocytes that can be present in our blood. The blood, leukocytes, white blood cells, there's 2 groups. They differ in color, size, shape, and nucleus. They could be granular, granules in the cytoplasm, or agranular without the cytoplasmic granules. It's part of the body's defense mechanism. It's formed in bone marrow lymphatic tissues. There's different types, which I'm going to have you review on your own. However, as we go forward in class, I will go over these in great detail. Thrombocytes are platelets aid in the clotting process by forming a temporary patch or plug to slow blood loss and contracting after the blood clot has formed. Their lifespan is 9 to 12 days. Plasma, this is the blank, the liquid portion of the blood. Anticoagulant does not clot. And I will go over this term in class as well. Blood cells are suspended in plasma, and plasma is composed of water and solutes. The plasma is basically the liquid portion of the blood once we centrifuge the specimen down. Hemostasis and coagulation. How does blood know when to clot and when to stay in the liquid state? This is hemostasis. Complex process that allows the body to control bleeding while still maintaining circulating blood in the liquid state. Phases in the clotting response. I'm going to have you view these next slides on your own because I will provide a detailed explanation in class to help understand this material. We have the vascular vasoconstriction, the platelet phase, the coagulation phase, the release of clotting factors to form a clot retraction, and fibrinogennesis, our vessel is repaired and blood begins to dissolve. As you can see, this is just an image that goes over this in detail, and again, I will review this in class as well, along with figure 7/26. Coagulation issues that impact phlebotomy. Drugs such as aspirin, heparin, and Coumadin or warfarin suppress clotting, so patients may bleed more or bruise more easily. DIC, or disseminated intravascular coagulation, emboli, and thrombi. Disorders of the cardiovascular system, we could have congestive heart failure, valve problems, vessel problems, which include arteriosclerosis, CVA, cerebral vascular accident or stroke, ischemia, aneurysm, or hemorrhage. I will go into detail in class to review this as well to better give you an understanding of what each disorder entails. Disorders of the blood, polycythemia, anemia, and leukemia. Hemostasis problems, hemophilia, embolus, thrombus, disseminated vascular coagulation. Hemophilia basically is the patient lacks the ability to clot. Polycythemia is basically overproduction of the cells or red blood cells. Anemia is the opposite, it's underproduction. I will give you tips on how we handle hemophilia patients when we get them in the lab. Common drugs for the cardiovascular system. This is more so an FYI for you. This just gives you an image of some hemorrhagic conditions, traumatic hematoma, and vein hemorrhage. The vein hemorrhage is commonly seen when we draw a patient. This happens underneath the skin, so it's not very visible at first, and this is the aftermath. Clinical hematology laboratory looks at the red blood cells, number, morphology, and hemoglobin content. And morphology is basically the shape of the morphology, number of platelets and white blood cells, bone marrow. Then we also have the coagulation laboratory, platelet function and coagulation factors. This is how does our blood clot. Immunology and blood banking is going to look at our blood types and cross matches. And clinical chemistry, which is our biggest piece in the lab, does serum and plasma constitutes. Example, this would be glucose level, lipid panels, complete and basic metabolic panels. Basically, in a nutshell, it's all of our electrolytes. The lymphatic system. The components of the lymphatic system are listed below. I will have you review these. The lymphatic system, as you can see, is branched out through our whole body. The lymphatic system maintains fluid, which is our blank, balance in tissues by filtration. It fights against disease. It absorbs fats and other substances from digestion. The other thing, it's closely intertwined with the circulatory system, so we need to be aware of this when we're drawing blood because we could run across situations, especially when patients have swelling. We need to be aware of what the lymphatic system can and can't do for a patient. Our second blank, it either is fight against disease or defense against disease. Either one would be sufficient. So approximately 30 liters of lymph fluid pass from blood to tissue space each day. And if the lymph nodes are removed, the body cannot remove fluids efficiently, so patients may have localized fluid retention, which I will show you an image in class. Disorders of the lymphatic system, I'm going to have you review on your own. This just gives you an image of those various disorders. The most common one we see sometimes in phlebotomy is the chronic lymphedema or accumulation of lymph fluid in the tissue space, commonly seen in the hands and feet, as in your image B. The lymphatic system laboratory tests, we have blood samples, bone marrow. Lymph nodes are often surgically removed or aspirated so that cells can be analyzed and or cultures performed. Analysis of markers on the surface of cellular material. This is commonly seen when we have patients that have mastectomy surgeries due to breast cancer. And that concludes Chapter 7 of our PowerPoint, Part 2.